Well, June in particular was such a good patient when it comes to those considerations because she had a really open mind, and she had ideas about things that she'd like to improve, and so then it was a matter of picking out priorities. And so what we try to do is, I could talk about all kinds of things over hours, but if you could focus on a couple that are most important. And then it has to do with the discussion about the procedure in mind. If there's something small we can do as an adjunct to something bigger, well, maybe that fits together pretty well. Otherwise, though, if there are a couple of major things, well, those are best separated out, and you have to sort of decide how to prioritize. Number one, she has great skin, and so you'd expect that to play along and retract nicely if we do any tightening. But number two, her attitude, and that's kind of probably the major thing. She's willing to be really flexible and really adaptable. When we had new technology, she was actually the first person that I offered laser liposuction, and she went for it. So we need people to be confident in our abilities and to broaden their horizons. So if you say, I'm interested in a neck lift or facelift, and I say, well, but I have a step-down procedure, a little bit minimally invasive, we ought to try this first, and maybe it keeps you from requiring full surgery for 5 to 10 years. It takes somebody with the flexibility of mind to say, yes, let's try that. And so she was really willing and to branch out in her initial desires. Well, in her case specifically, we had some considerations for timing in order to lift and tighten skin prior to doing things like breast augmentation, and that is an important pathway for safety and to avoid complications. And so in that way, she was a great candidate again, because she really understood when I said there's a way that we have to do it in order to keep things safe. From there, we talk about goals again, and a lot of it has to do with perhaps an event that somebody has coming up. And if we can prepare them in a way that their body looks just right for that, then they have that confidence and they can look forward to the event even more. So we try to prioritize that way. And then in terms of making a longer term plan, we really like to do that too. If it becomes something where somebody has now a familiarity with us and with our office and likes the staff and gets to know people like they're really kind of a family, then they're more likely to come back and follow through with the plan and ultimately be successful. They have questions about what they should do because, again, they consider us the experts in aesthetic. So we can give some suggestions, but a lot of times people have questions about things that they've heard or seen about on TV, on the internet, or they have friends who've had similar procedures. So the questions that I get are, my friend had abdominoplasty, they recovered over 3, 4, or 5 weeks and said it was terribly painful. How do you do it differently? And that's one of the most exciting things I can describe, because we can do that operation with a week's downtime, maybe 2, some abdominal soreness that feels like sit-ups, and I do so without drains, and you can shower and be fairly active within a week. The discussion often may have to veer because their body isn't set up for the same augmentation operation. Maybe we have to do mastopexy or breast lift. Maybe there are other things that come up and they say, I really want you to do tummy. Okay, so we have the flexibility within the practice, within the time we spend, and within our attitudes and our perception of the problem to change course as need be. And so patients who understand that flexibility as well often end up following a path that we design, which is really the best and optimal thing for them. And this is really, I think, true across the board. If you follow up patients long enough after operations, and you see them back 3 months, 6 months, a year or more later, they're happy with the surgical outcome, there's no question, but they're a different person in terms of how they approach things. And we see plenty of people who go on to be really active with exercise, weight loss, diet, even improving in their social lives, and they kind of often can trace back to something that we've done together. We have 14 full-time staff. That includes estheticians, front office personnel, even billing. And to a person, I suspect that they all know June by first name, and she probably is starting to know most of them by a first name basis. And so for us, it's way more than the doctor-patient relationship. It's the whole office, and that's what makes people feel comfortable when they come to our office and they aren't peppered with the same old questions or sign in on this line. No, it's welcome back, June. How are you? What's new? I think that's a more personal situation, and I think makes people more comfortable to trust our advice. But again, that happens at a level beyond just doctor-patient. That really has to do with the full staff and the full complement of our folks. I think it's a welcome bonus that you can have every bit of the quality in Traverse City that you think that you need to travel to receive. I don't think that that's true anymore, and I think that we have state-of-the-art facilities with absolutely top-end techniques and technology. We've invested heavily in things like lasers, laser liposuction, and these are the top-end machines, top-end technology on the market today. That includes now for our office cool sculpting to reduce fat without incisions. So we've invested heavily, we've trained extensively, we think we offer an excellent product, and we do so at reasonable prices close to home. There's really nothing to, there's really no downside, and so for the people who've discovered that and trusted us, we think they've seen good benefit.